In this video, we'll discuss about end-stage renal disease. It is also called as end-stage kidney disease or end-stage kidney failure. The kidney filter waste and excess fluid from blood. So, when they fail, waste buildup and there is a gradual loss of kidney function. So, this kidney filtered waste, excess fluid from blood. When they fail, waste buildup and there is a gradual loss of kidney function leading to chronic kidney disease. Excess fluid from blood, that kidney was filtered. Failure means waste buildup and there is a gradual loss of kidney function leading to chronic kidney disease. Chronic kidney disease progress slowly over about 3 months and goes through 4 stages. So it progress slowly over about 3 months and it have 4 stages. First one is kidney impairment, then kidney insufficient, kidney failure. When only 10% of kidney function remaining, that one is end stage renal disease. What are the 4 stage? Kidney impairment, kidney insufficient, kidney failure, end stage renal disease. Next, what are the causes? Most common causes diabetes and hypertension. Other problem that can cause kidney failure including autoimmune disease such as lupus, genetic disease such as polycystic kidney disease, then nephrotic syndrome and urinary tract problem. So what are the main causes? Diabetes and hypertension. Other problem, autoimmune disease, genetic disorder, nephrotic syndrome and urinary tract problems. Then what are the signs and symptoms of end stage renal failure or chronic kidney failure? Chronic kidney failure result from imbalanced fluid and electrolytes, altered regulatory functions of that body. So here it will alter regulatory functions of that body and retention of solutes. Chronic kidney failure results from imbalanced fluid and electrolytes and altered regulatory functions of that body and retention of solutes. Anemia result from impaired RBC production. So patient reports lethargy, dizziness and fatigue. Anemia result impaired RBC production. So patient feel lethargy, dizziness and fatigue. Fluid and sodium balance is abnormal. So the fluid and sodium balance is abnormal and may involve either abnormal retention or secretion of sodium and water causing high urine output or no urine output. Sodium and fluid balance abnormal may involve either abnormal retention or secretion of sodium and water causing either high urine output or no urine output. Other symptoms, it causes headache, nausea, vomiting, lack of appetite, then itching, muscle cramp, swelling in feet and ankles. So these are the symptoms: headache, vomiting, nausea, lack of appetite, itching, muscle cramp, swelling in feet and ankles. Troubles catching breath and insomnia. Then chronic kidney disease or failure affect all body system including it causes shock, sepsis, bleeding, anemia, hypertension, hyperkalemia, congestive heart failure, and pulmonary edema. Then pericarditis, atherosclerosis, peptic ulcer disease, peripheral neuropathy, bone density loss, and metabolic encephalopathy. These are the symptoms. Pericarditis, atherosclerosis, peptic ulcer disease, peripheral neuropathy, bone density loss, and metabolic encephalopathy. The treatment of chronic kidney failure also places the patient at risk for other complications. Patient at risk other complication. First one is hemodialysis. Hemodialysis often required multiple hospital admissions for problem with vascular access device include infection, clotting, and displacement of catheter. So hemodialysis often required hospital administration for problem with vascular access devices including infection, clotting, and displacement of catheter. Renal failure is diagnosed by using lab tests including serum creatinine level and 24-hour urinary creatinine clearance test. So renal failure can be diagnosed by using two tests. One is serum creatinine level and 24-hour urine creatinine clearance test, which both are essential in the elevation of kidney function. So to test 24-hour creatinine, the 24-hour urinary creatinine clearance and serum creatinine clearance. Serum creatinine test elevated, 24-hour urinary creatinine clearance test decreased. Next, CBC, complete blood count, would shows decreased hemoglobin and hemoglobin and hemocredit. The blood chemistry shows electrolytes output of balance. Blood chemistry, CBC count here, hemoglobin decreased, hematocrit decreased, both are decreased. In blood chemistry, serum level whether increase or decrease, potassium level increase, calcium level decrease, phosphorus level increase, magnesium level increase, serum pH whether decrease or in normal, serum bicarbonate are decreased. Then a renal ultrasound will shows the size and shape of that kidney used to detect a mass or kidney stone or cyst or other abnormalities. So renal ultrasound will show size and shape of that kidney used to detect a mass, kidney stone, cyst or other abnormalities. Treatment for chronic kidney disease focus on stabilizing the internal environment by controlling fluid and electrolytes balance, preventing infection, controlling existing disease, and correcting anemia, prevent complications. So what are the controlling method? Fluid and electrolytes balance, preventing infection, controlling existing disease, then correcting anemia and preventing complications. Then metabolic acidosis occur because the damaged kidney are unable to excrete the normal load of acid generated by metabolism and is corrected by giving sodium bicarbonate. How to correct? By giving sodium bicarbonate. This one, damaged kidney are unable to excrete that normal load of acid generated by metabolism and corrected by giving sodium bicarbonate. Then hyperkalemia condition is treated with diuretic therapy or chiacylate. So next one is hyperkalemia is treated with by using diuretic therapy or chiacylate. When kidney failure, the abnormality, the ability to excrete phosphorus decreased. When we have kidney failure, ability to excrete phosphorus decrease, and a cycle of hypokalemia and hyperphosphatemia result in significant bone density loss. This one is the healthy bone graft, this one is the osteoporosis bone graft. So here when we have kidney failure, ability to excrete phosphorus decrease, and cycle of hypocalcemia hyperphosphatemia result in significant bone density loss. Then goal of treatment to decrease serum phosphorus level by restricting phosphorus in the diet, giving phosphate binder, that is calcium carbonate and calcium acetate. What is the treatment? Restricting phosphorus in the diet. So eliminating dairy product and restricting proteins, then giving phosphate binder, calcium carbonate and calcium acetate. Usually, a reduction of phosphorus is associated with small increase in serum calcium. Phosphorus associated with small increase in serum calcium. Anemia, it is accompanies chronic kidney failure because there is insufficient production of erythropoietin by the kidney disease. Because of kidney disease, insufficient production of erythropoietin leads to anemia. Then administering EPO, the recombinant form of human erythropoietin, increase hematocrit level, decreases need for blood transfusion and improve energy level. This administering EPO, recombinant form of human erythropoietin, increase hematocrit level and decrease need for blood transfusion and improve energy level. Then most patient receiving EPO also need iron supplementation. Along with EPO, patient need iron supplementation due to iron deficiency associated with chronic renal disease. Then end stage renal disease is irreversible and required two type of treatment. One is dialysis and or kidney transplant to survive. So two things they required. One is dialysis, second one is kidney transplant for their survival. So first we want to discuss that dialysis, removing waste substance and fluid from blood that are normally eliminated by the kidney. What is the role of kidney? Waste substances and fluid normally eliminated by our kidney. It helps restore fluid and electrolytes balance and control acid base balance. What is the main role of kidney? Fluid and electrolytes balance and control acid base balance and removal waste and toxic material from that body. So two type of dialysis is there. One is hemodialysis, another one is peritoneal. First we want to look at that hemodialysis. It involved in moving that patient blood from that body through a dialyzer. Okay, how it will remove? Through a dialyzer in which diffusion and ultrafiltration occur and then back into that patient circulation. So it these hemodialyzers moving that patient blood from that body through dialyzer in which diffusion and ultrafiltration occur, then back into that patient circulation. This hemodialysis required access to that patient bloodstream and performed chronic being anteriovenous fistula, anterior venous fistula, AV fistula. This fistula is made by surgically joining an artery and a vein under the skin in the arm, which increase the pressure inside the vein, making the wall of vein stronger. After about 3 to 4 months, the stronger vein has healed and can receive the needles used for hemodialysis. The fistula can then be used for many years. An anterior venous graft, AV graft, is made by surgically joining the radial artery and a vein near the elbow with the plastic U-shaped tube. Here, U-shaped tube, and it is usually ready to use about 3 weeks after the surgery. These AV graft, anterior graft, are usually not as long lasting as anterior venous graft fistula, but can last several years if we well cared for. These anterior venous graft are usually not longer lasting as AV. This anterior venous fistula, but can last several years if well cared for. Then temporary central venous catheter are placed in the internal jugular vein, where placing the temporary central venous catheter are placed in internal jugular vein or femoral vein for dialysis, while the AVF, anterior venous fistula or anterior venous graft, is healing. Next, hemodialysis is usually done several times a week, last for 4 to 5 hours. Then complication, it including muscle cramps, sudden hypotension. Then side effect can be avoided by following the proper diet, taking medication as prescribed. So how to avoid side effect? Following proper diet and taking medication. Then peritoneal, second type of dialysis, peritoneal dialysis, it involved in instilling dialyzing fluid in that peritoneal cavity, with the peritoneum serving as the dialyzing membrane. A soft catheter is inserted in the lower abdomen near the navel, and approximately 2 liters of warm sterile dialysate is infused into the peritoneal cavity over about 10 minutes. The fluid is left in that peritoneum for 20 to 30 minutes to absorb the waste product and the toxins. Then it is drained out by gravity. 3 types of peritoneal dialysis. One is continuous ambulatory peritoneal dialysis. Then continuous cystic peritoneal dialysis. Third one is intermittent peritoneal dialysis. So 3 type of peritoneal dialysis. First we want to look at continuous ambulatory peritoneal dialysis. Does not require any machines. The exchanges, the passes can be done 3 to 5 times daily during waking hours. Okay, this one will no need for machine. Exchange can be done 3 to 5 times daily during waking hours. Second one is continuous cystic peritoneal dialysis. Required the use of special dialysis machine that can be used at home. It is done automatically even while sleeping. Third one is intermittent peritoneal dialysis. Use the same type of machine as the continuous cyclic, but treatment take longer. Complication with the peritoneal dialysis, infection of that peritoneum and peritonitis. That means it causes fever and stomach pain. So complication with the peritoneal dialysis, it causes infection, fever and stomach pain. Then what are the advantages of peritoneal dialysis? It provides steady state of blood chemistry value. It can be used for patients who are hemodynamically unstable. Then it is essential easily thought to patient, allowing them to dialyze at their convenience without the need for machinery. So what are the advantages? It provide steady state of blood chemistry value used for patient hemodynamically unstable, then easy for dialysis at patient convenience without the need for machinery. Then dialysis treatment are not cure for end stage renal disease. It will help patient feel better, live longer. Next, another treatment options for kidney transplantation, which reserve many of the pathophysiological changes associated with the kidney failure. What about kidney transplantation, which resolves many of the pathophysiological changes associated with the kidney failure? It also eliminates the dependence on dialysis and the need for dietary restriction. Diet for therapy for end-stage renal disease or syndrome must take consideration based on the laboratory result, nutritional status, plan for dialysis, transplant and no treatment. Limiting protein help reduce the waste buildup in the blood. However, protein intake must be adequate to avoid malnutrition. So, limiting protein reduced waste buildup in the blood, but protein intake must be adequate to avoid malnutrition. Then potassium buildup in the body when kidney function decline. So it is the best to avoid high potassium food in and monitor potassium level regular. Food high in phosphorus should be avoided due to phosphorus calcium imbalance and bone changes that occur in chronic kidney disease. Fluid restriction and sodium restriction vary greatly with these patients, so it is helpful for the patient to be evaluated by a dietitian. So in this video we are discussing end stage renal disease introduction part. It will progress over 3 months. It having 4 stages. Main causes diabetes and hypertension. Other causes sign and symptoms anemia, fluid and sodium balance. Other symptoms chronic kidney disease affected all body system. What are the different type of diseases? Then treatment, hemodialysis and organ transplantation. Then total blood count we want to take. Then blood chemistry, renal ultrasound treatment. Then metabolic acidosis mean then hyperkalemia condition, then goal for the treatment, then because of anemia, then administering EPO, then end stage renal disease, irreversible it require dialysis and kidney transplant. So two type of dialysis, hemodialysis and peritoneal dialysis. Peritoneal, then three type of peritoneal dialysis, then thanks for watching.